We are seeing an outbreak of measles in West Texas because there are a significant number of people there that are unvaccinated, and someone likely came back from an area with measles transmission, an infected individual, to that community. And because of the unvaccinated people there was ongoing transmission, and that's where we're seeing this rapid increase in the number of cases. One of the important things for every community to do is to try and get enough people vaccinated so we can protect those people in our community that can't get the vaccine or are unexpected to have the appropriate response to the vaccine if they're immunocompromised. If you're immunocompromised, there's a lot of things you have to think about, including measles, right? You need to think about what your risks are and go in crowded public spaces. You should try to avoid people that are ill. You should do good hand hygiene. During time periods of high transmission of measles or other viruses in your community, you should consider wearing a mask if you're going to crowded indoor settings. The measles vaccine is very safe. It was introduced in 1963, which means at this point we have decades of time observing people that have received the measles vaccine. So serious side effects are extremely rare. Most common side effects that you can see with the measles vaccine, people can have a sore arm. Some people, less commonly, can develop a fever, and that's pretty rare. Some children develop a rash about 7 days after receiving the measles vaccine. That rash is not onset of measles. They aren't transmissible to other people, but it can occur about 7 days after the receipt of the vaccine. The measles vaccine is very effective. So one dose of measles vaccine provides an estimated 93% protection against infection. And then the second dose, which is recommended now, gets you up to 97%, which means that out of 100 people, only 3 people will get measles infection. People that get infection or breakthrough infection after they've been vaccinated tend to have milder illness and are considered to be less transmissible to others. For an unvaccinated person needs 2 doses of the measles vaccine. That's what's generally recommended. As an adult, it's recommended that you get a dose, and then the second dose can be given as early as 28 days or 4 weeks later. It is still possible to get measles if you're vaccinated. So again, 2 doses gets you up to 97% protection, but that means that about 3% of people can still get infected, so it's not 100%. Most things aren't 100%. But again, those people that do get breakthrough infections tend to have milder disease, and they're less transmissible to others as well. So for people that have their records, their vaccine records, have access to those and can see that they've received 2 doses, that's lifelong protection and they don't need a booster. But many people may not have access to their vaccine records. If you don't have access, you can talk to your provider. It is safe to get another dose of the MMR vaccine to make sure that you're up to date.